My name is Hannu Kinnunen. I'm the Chief Scientific Officer at ŌURA. And before joining ŌURA, I worked for almost 18 years at Polar, and I was their principal scientist. When I was working at Polar, I attended exercise and sports science meetings annually. And I learned from there that there are huge health benefits associated with being physically active. You all know these: weight control, reduced risk of cardiovascular diseases, type 2 diabetes, even reduced risk for some cancers, better health of bone health, and so on. When I joined ŌURA, I went to sleep conferences. And I learned that the benefits of good sleep are very, very similar. And it struck me because these two areas of science don't talk with each other so much. And my idea is that maybe they should. And maybe as individual peoples, we should wonder the relationship between our recovery and our load, to make sure that we don't overload ourselves, but we find the times when our body is most ready for physical activity, exercise, and when it needs rest. When we go deeper into these bad effects of sleep deprivation, we understand that there are so many of those. And we can also feel this immediate effect of bad sleep if we have difficulties to concentrate. And we may also understand that the importance of sleep for our hormones, the whole endocrine, our systems and our biotiming and timing of everything in our life. At ŌURA, we would like people to ask themselves at what kind of life your body is ready for today. How has your body responded to your lifestyle lately? With the ring, you can see how your daily choices and rhythms have affected your sleep and recovery, and also how the quality of your sleep affects your health and readiness to perform. These things work in a cycle. You can't separate your exercise training from taking care of good recovery. Our product is a ring, very comfortable to wear, unnoticed once you start using it. It's a smartphone app and web UI, which is going to be published very soon in May. The ring measures your arterial pulse amplitude. It also has a three-dimensional accelerometer and a temperature sensor. It calculates a lot of signals from these three main raw signals, including pulse amplitude variation, heart rate variability, respiration rate, and intensity of physical activity. The signals have been validated against golden standard methods, and in the following, I would like to show you that they are reliable. The ring was just recently validated independently by Stanford Research Institute and published in a peer-reviewed scientific journal. The results were very promising and especially thinking the long-term use of the ring, because this polysomnography is not possible in a long-term measurement. This is the figure of that publication. And here you can see the good and the bad sides of the recording. The ŌURA seemed to a little bit underestimate deep sleep and overestimate REM sleep, particularly in the latter part of the sleep. Yet, all significant parameters correlated very well with the sleep laboratory measurement. Heart rate measurement is very reliable. Here I compared the average heart rate, overnight heart rate between ECG and ŌURA ring in 10 individuals who were wearing a ring on both of their hands. The ring signal quality was considered reliable enough for heart rate measurement on average 95% of time during the night. Heart rate variability shows a little bit more variability, but it turns out to be about 2 milliseconds accurate. The temperature sensor in the ring has also been shown to be much more reliable than we initially thought. Because at night, when you are under the sheet, your skin temperature approaches your core body temperature. So sometimes, by getting a warning in the morning that your body temperature during the night was slightly elevated, you can be able to react early. But at least after getting sick, you can follow up when your body might be ready for training again after being sick. This is an example of my data. Around December 5th, I had a fever. My temperature was back to normal December 10th. My resting heart rate was back to normal the following day, but my respiration rate was elevated until December 27th for 3 weeks. More than half of us are women. It is very eye-opening to see for a man that the temperature of a woman is going up and down in a monthly cycle. And it opens my eyes to understand that a lot of hormones are actually on the background, having very huge differences according to the menstrual cycle. It's possible that in the near future, we can be able to improve or help people to find their personal fertile window. And already now, these graphs enable women to look and analyze their cycles. This graph is from another woman, showing that there are individual differences. So everybody will be most interested in their own body. It's interesting to think about the role of menstrual cycle in training periodization. There's some recent study findings from a Swedish study that by concentrating high-intensity trainings on the first half of the cycle produced better training results than even distribution, or especially than having the highest training load of high intensity during the second half. I can see a lot of potential. So, summarizing a little bit, the ŌURA ring is very comfortable to wear. It provides data that is almost as good as laboratory data, even though it's missing diagnostic ability. It is equal to the best alternative methods outside the sleep lab. It's scientifically validated, and it costs pretty much nothing compared to the real cost of these laboratory measurements. We have customers in 50 countries, and big majority of them are in the US. Our users are people who give value to the balance of load and recovery, and who understand the importance of sleep and your body responses like heart rate variability. Our customers are also those people who are interested about their own biology and their own data. And a lot of pioneering people who know that by doing some changes in their life, they can maintain and achieve best performance. The ring is a design object, beautiful one. Thanks.